Hi, good evening. I'm Dr. Niteen Deshpande from Nagpur. I'm an interventional cardiologist, and with me we have Group Captain Dr. Ajay Swamy from Pune. And we are here to bring you the wrap-up for this today of CSI conference and the proceedings at the conference. As usual, Saturday is a very busy day in CSI conference. A lot of activities happening, presidential orations, and in addition to that, we had a beautiful activity which was conducted by CSI in the morning, which was Run for the Heart in the morning. It was a marathon where a lot of people participated to create awareness about the heart disease in this activity. And it was really fun to participate. The scientific session started at 9 o'clock in the various halls. Multiple halls were running simultaneously. The first session, major session, which was focusing on heart failure, discussed a lot about heart failure, the clinical aspects of heart failure. The main message which was delivered by the various panelists and speakers through this session was optimization of heart failure management with medicines is the most important thing that we should be doing in the clinical practice.
Yeah,
and the other message that was delivered was the heart rate maintenance in patients who are optimally managed should be at 70 to 75 beats per minute in the resting. Devices, of course, make a very, very important issue in management of heart failure. However, multiple financial concerns here restrict them, and therefore we need to use the medical management at least optimally. The session following that was the second BC Roy oration, which was delivered by Doyen of Cardiac Surgery, Dr. K.M. Cherian sir. And he has so many firsts to his credit in India, starting from the first open heart surgery to first IMA to first complex congenital heart disease, and this all was reflected through the speech that he delivered. We really were mesmerized by his
extremely inspirational.
And he showed a clip of Professor Christian Bernard speaking in one of his programs, where Christian Bernard mentioned that doing such complex surgeries is really a man, it separates people or boys from men from boys.
Yeah.
So he sort of complimented Dr. K.M. Cherian. This clip is way back, I guess, 25 years back in the time, and where he recognized the importance of the work that Dr. Cherian was doing.
Sure.
Ajay, would you like to cover the
I
next
think
few
Dr.
sessions?
Cherian's, talk was extremely inspirational. It shows us what you can do in the face of adversity if you take adversity as opportunity. After that, we had our president-elect delivering the presidential oration, and he focused on the evolution of left main angioplasty. As you know, the left main disease is actually something that's quite malignant and has not been really on the radar of interventionists. But over the last 15 years, the evolution of left main angioplasty has brought it to a level where it is as good and in some cases equivalent and sometimes better than bypass surgery for this particular subset. And it was an extremely comprehensive review of everything that has happened over the last 20 years. Thereafter, Dr. Das spoke to us about sinus node dysfunction, and he discussed his work over the last decade and a half, 2 decades nearly. Since this time, he worked on it as his thesis topic actually, and that was also extremely enlightening. And our Dr. Narasimhan then spoke on maximizing the benefit of heart failure devices, and showed us the importance of medical management prior to the patient going on to a device, and how to perfectly optimize the placement of the device and how to follow up such patients thereafter to get the maximum benefit, and the importance of left ventricular pacing and how to optimize left ventricular pacing. And Professor Bax and Professor Talwar were the subsequent distinguished speakers, and they spoke to us about cardiovascular imaging. Professor Bax spoke about cardiovascular imaging, especially about CT coronary angiogram, and Professor Talwar spoke to us about he enlightened the hall about the importance of ICDs and what is the correct indication for ICDs in view of the cost, and what is the correct way in which to decide how to place ICDs in patients with non-ischemic cardiomyopathy, which is a very large subset, and the importance of stratifying them by looking at the late cardiac enhancement and the amount of scarring that one sees in the myocardium prior to actually making a decision about the implantation of the ICD. I think they were excellent sessions. What do you say?
Yeah, I think the most important point that he brought out was focusing on the myocardial fibrosis as detected by the late gadolinium enhancement. So we should be using MRI more and more to
frequently,
look for gadolinium enhancement. Subsequently, we have had multiple senior Western faculty speaking in multiple halls in this conference. And there was a beautiful lecture delivered by Professor John Cleland, which looked at guidelines, and it focused on the discrepancies of the heart failure classification based on guidelines, mid-range ejection fraction versus reduced ejection fraction in Australian versus the American guidelines.
Correct.
And he sort of simplified that and insisted that the medical management must take into account all the patients of reduced ejection fraction and treat them optimally.
In fact, he made a very nice statement that 49 is the new 40.
Absolutely.
Is the new 40%.
Absolutely.
And the importance of the newer biochemical markers that we have in plotting the natural history of heart failure,
Absolutely.
which have not been part of guidelines so far.
Yeah. Professor John Camp subsequently spoke on the role of ablation, catheter ablation in treatment of atrial fibrillation, wherein he made a very, very important point that although the antiarrhythmic therapy reduces recurrences of atrial fibrillation, it leads to proarrhythmia and it leads to increased mortality.
True.
And that is exact role of atrial ablation for the atrial fibrillation in management of these patients. Unfortunately, the trials have been of small number of patients. They have been of small duration. However, Cabana trial is one such large trial which can really make us think about consideration of these type of patients. Dr. Srinath Reddy could not attend the conference, and Dr. Prabhakaran delivered the lecture in his place. And Dr. Prabhakaran spoke on predominantly the Ayushman Bharat Yojana, which is going to be launched, and how it will impact. And Dr. Prabhakaran was of the opinion that the road is not too long. If we walk it correctly, we will be able to cover the road very fast. Dr. Sethi spoke on patients of chronic stable angina, how to identify high-risk patients, and he mentioned multiple points in this. And I think ejection fraction was one of the important points that he mentioned, and number of vessels, how they are diseased. So that was predominantly happening in main arena of the conference in the morning session. Ajay, you have any other inputs from other halls in the
the other halls also had extremely interesting sessions. Cardiomyopathy, multiple types of cardiomyopathy were discussed. Hypertrophic cardiomyopathy, restrictive cardiomyopathy. There were sessions on rheumatic heart disease, which were also extremely illuminating. Although we are forgetting about this. In fact, the title was The Forgotten Emperor, and that was also extremely comprehensive on rheumatic heart disease. Then there were sessions on tropical cardiomyopathy with infiltrative cardiomyopathy and other causes of tropical cardiomyopathies that were also discussed. There was a whole session on postgraduate teaching, and it was extremely well attended. And
I think that's a very, very busy session, and very senior people spoke on, and I'm sure our students must have derived great benefits out of sessions like that.
And we had poster sessions in which students had presented their work and their research work, which was seen and assessed by critical experts, and they were given feedback about how to get it better and what's the next step to be taken, both in terms of posters and in platforms. And it was very heartening to see the kind of work that is being done. So there is still some hope, although clinical research has to develop a little more in methodology. But I think it is alive and well, and with a little bit of help, I'm sure they'll be able to take the next step and move to the next level. And then there was one very interesting session on recent advances in devices, in which the recent devices like the leadless pacemakers and the subcutaneous ICDs and the wearable ICDs and the MRI compatibility of pacemakers. All these issues were discussed by experts who are dealing with this in day-to-day life, and I think it was extremely illuminating, and it shows us that these are the gaps in our knowledge that we need to fill, that we need to extend the benefit to our patients in this subset.
Yeah, all in all, I think we have had a lot of sessions this time on heart failure devices and prevention of sudden cardiac death. There was an interesting session on acute myocardial infarction, where various aspects of acute myocardial infarctions were discussed. And Dr. Vijay Iyer from US made a very, very important point that patients who were treated in cardiogenic shock, especially who were treated with inotropes, had actually higher mortality.
Worse outcome.
So they may be reflecting a very poor subset of patients,
absolutely,
where the support devices like Impella can work wonders, and that's what he showed. Professor Chapman subsequently spoke on one important aspect of statin therapy, that is the side effects, and which have been discussed and promoted by many adversaries, that statins lead to diabetes, statins leads to muscle symptoms, and he effectively negated that feeling, and he showed that it is a very small percentage of patient which actually develops these side effects. However, the benefits,
that's an important message to go out.
outweigh so much that you need to actually be watchful for this, but don't worry about these small side effects.
Correct. So in the correct patient, in the correct dose, statins are invaluable. They are part of our armamentarium as of today.
So I think all in all, this was a very productive day with a lot of guest faculty guiding us on various issues of cardiology. And I think the final program, which is still on, is the cardiology quiz. I guess most of the people enjoy cardiology quiz so much. So here I am with Dr. Ajay for the daily wrap-up. Thank you so much for being with us. Thank you.
Thank you.